This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Our immune system is designed to combat and protect us from destructive viruses and bacteria. But sometimes, it can wage war on some foreign substances that can be pretty harmless for most people. The main culprits are usually allergy-producing substances called allergens, which are often erroneously identified as dangerous and unfamiliar invaders by your immune system. The most common allergens include certain food items such as peanuts, milk and eggs, pollen, dust mites, insect stings, some medicines and clothing, plus many others.
Well, here in the Philippines, the most common manifestation of our term allergies would be a skin rash that is longer than the usual amount of time that these things last. Most patients beyond 6 weeks would usually come in for testing, but other manifestations would be runny nose, sneezing, cough, congested nose in the morning. These would be symptoms of an allergic rhinitis, wherein the swelling is actually inside the nose.
Allergy should be dealt with seriously, as one reaction can lead to something severe.
An allergic reaction can be life-threatening. It's called anaphylaxis. This is when there is a trigger that causes a very severe allergic reaction. The throat closes, you have difficulty breathing, your blood pressure suddenly drops down, you may lose consciousness, and you get swelling in the mouth, in the tongue, which makes it difficult for you to talk or even to breathe. And yes, it can lead to death.
Allergies can be developed at any age and can obviously be annoying, but it does not have to be disabling if treated and managed properly. What are some of the risk factors for allergies? What allergy medications can you possibly take? Find out the answers tonight on MedTalk. And joining us tonight is Dr. Maria Carmela Casala, a fellow of the Philippine Pediatric Society and a public relations officer and fellow of the Philippine Society of Allergy, Asthma, and Immunology. She's also the head of the allergy section in the Department of Pediatrics of the Medical City. Also joining us tonight is Dr. Regina Capulong, a diplomate of the Philippine Society of Allergy, Asthma, and Immunology, and a consultant of the Medical Center Manila and Manila Doctors Hospital. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel. It's good to be here.
Allergies. What exactly is an allergy?
Okay. Allergy is actually an overreaction or hypersensitivity reaction to substances that are usually not harmful to other people. But for somebody with allergies, once you encounter now these allergens, what the body does is that it produces now what we call antibodies that recognizes intruders in the body. So thus antibodies will now travel to the mast cells that are found on the skin and the respiratory tract. And once you encounter again these allergens, then you may have the allergic reaction.
Dr. Casala,
Yes.
allergens. Dr. Capulong mentioned allergens. What exactly are allergens?
They're the substances that you get to be sensitive to. No? They're usually protein substances, and that anything possibly in the world can actually be an allergen. No? So whatever you're sensitive to, those are the allergens affecting your life. Okay. Now, like Dr. Capulong mentioned, no, these allergens, if you're exposed to them, that's when you get a reaction, an inflammatory reaction that happens during that time. And that's when you actually get all this itchiness, this teary-eyed or itchiness of the eye, sometimes even asthma attacks. No? So the hives also come out.
And these are the reactions that your body has to a certain substance. It could be anything.
Yeah,
from
and
food
even
to the
the
environment.
Even the reactions are different and varied amongst people. No?
And the reactions are different and they're varied amongst people. This reaction of our body, is it called an attack, an allergy attack, just like an asthma attack? Would you say that it's the same?
It would be probably better to call it an allergic reaction than an attack. But some people call it an attack because usually what they would notice would be the acute reactions after being exposed to an allergen. So it would be better that we call it an allergic reaction.
Okay, so now it's an allergic reaction. I wrote it, allergy attack. So that's not the nature of what happens to
Kasi
your
parang
body.
very negative naman. No?
Yes,
Because
yes.
in actuality, an allergic reaction is actually the body's way of defending oneself. Because the body thinks that this is something that shouldn't be with you, so it tries to eject it. And in so doing, you get some inflammatory reaction, and that's when the whole thing blows over. No?
An attack is parang more severe, no? It's more of a medical emergency.
But
when
we
say
do
it's an
use
attack.
it for, like, say, asthmatic
Asthma.
attack,
Which is also a
which
form
is
of
also
allergy.
a form of
Yes.
allergy, right?
Okay. So what is the nature of an allergic reaction? What happens to our body when we are, let's say, allergic to a certain type of substance? Dr. Casala.
Well, when your body, okay, when the defense mechanisms in your body meet your nemesis,
Okay.
your allergen, then a certain reaction happens, and they actually cross-link, and then this causes the mast cells to release preformed chemical mediators. No, mast cells are actually specialized cells in the body that are responsible for this, all these allergies. Now, so when the preformed chemical mediators are released into the system, including histamine, now that's when you get all the redness, the erythema, the itchiness that you have, the difficulty of breathing perhaps, and all the hives. No? And that's why most medications that people know to use for allergic reactions are called antihistamines because they fight off the effect of your histamine, which causes all these symptoms that you have.
Dr. Kapulong, how common are allergies?
Actually, it's very common. Around 1/3 of the whole population, meaning worldwide, actually have allergic diseases. In the Philippines, it would range to about 20 to 30% for the respiratory allergies. So, and that prevalence is actually increasing because of the increased awareness that allergic diseases do exist. So the prevalence, we'll expect it to get higher.
Prevalence meaning, the number of people who have it
Yes.
and who are actually suffering from that disease.
But that's a big number around the world, 1/3
Yeah, 1/3.
of
Oh,
those who
yeah.
have allergies.
In fact, if you make kunyari may survey ka, just,
Siguro among,
dito.
kunyari, 10 people, kunyari here in
Here lang in the studio,
studio.
you ask around, you probably would get roughly 1/4 to 1/3 of the population.
Are you part of that population, doctor? Do you have allergies?
Me personally, I don't have. But I'm more of the rarity when it comes to the allergies, not having any allergy complaints. Usually meron, but I'm one of the few who don't have.
So that means your immune system is good? Does that hold true?
No, it just means maybe that there's not much family history for allergies. We have to discuss that family history.
Family history.
Ask Reggie. She's the
Dr.
allergic
Kapulong,
one.
do you have allergies?
Yeah, I have atopic dermatitis. It started when I was younger, and then later on I developed allergic rhinitis. But what Dr. Casala mentioned earlier, there really exists a family history because my mom also has atopic dermatitis. I have a sibling who has allergic rhinitis and bronchial asthma. And my children also have these allergies.
Mana-mana.
That's why,
Mana-mana pala.
mana-mana.
What about
Lahat
you,
to.
Angel?
Yes,
Would you
I
have
do.
also?
I do have allergies, which brings us to the categories of allergies because I do have food allergies, a little bit of atopic dermatitis, and I'm allergic to pollen. So those
Which
three
came
categories.
first? Okay, which came first with you?
Oh, well, pollen.
Okay.
As in high school, in the morning and at night, I'd get sniffles. Is that common?
Okay, yeah.
It's very common among Filipinos.
what is the usual progression of allergic diseases would be more of like what happened to Reg.
Doctor,
no?
yes.
She had atopic dermatitis as a young child, moving on to having nasal allergies and respiratory allergies later on. That is the usual progression. Not always, but that's the usual progression.
Okay, so no food allergies, doctor?
I don't have.
Okay.
It's, when I had a skin test, I just tested positive to pollens.
Okay, so pollen only and no food allergies. But
For me.
for you.
Yes, yes, yes.
But for others,
Fortunately, because I really love to eat. And it's so obvious that I really love to eat.
but you also have to take you have to take good care of these allergies so it doesn't progress into something else because as you said, it's a progression. And if you get it when you're young, as you get older, you develop more allergies, no?
Which is why it's important, actually, to find out what you're allergic to. Kasi allergy, no, is a disease of exposure. Kung hindi ka ma-expose dun sa particular allergen na yun, even if you're sensitive, even if you tested positive for it, then you won't have any manifestations. So mahirap naman na mag-avoid kung hindi mo alam kung anong i-avoid mo,
That's
diba?
true.
So first and foremost, try to find out what you have to avoid. Have yourself tested and find out what your triggers are, what you are sensitive to, so that it's easy for you to avoid it.
Okay, you mentioned the test. Before we cut to a break, I'd like to know what the test is about and why the test is needed. Is it needed for people even without allergies who only have a family history of allergies?
Good.
Actually, it's indicated for those already manifesting or have clinical manifestations of the allergy. So if you have a family history, that's not a good enough reason just to have the test. Although some patients would request that, okay? But it's actually indicated for those with clinical manifestations of allergy or you're suspecting that you're allergic to something. It's something very important because we really need to identify whatever the allergen that's causing your symptoms because you have to avoid it. So you won't be able to avoid something you don't know. So you really have to avoid it.
We'll talk more about food allergies, allergies from the environment, and allergies to medication as well.
Yes.
All that and more when MedTalk returns. Famous celebrities also suffer from food allergies just like ordinary people. These include Halle Berry, who is reportedly allergic to shrimp, Zooey Deschanel, who stays away from dairy products, and Drew Barrymore, who is reportedly allergic to garlic. We're back here on MedTalk, still talking about allergies. You may join the discussion by calling our hotline at 548-4678. Doctors, we have a caller on the line. Good evening, John.
Easy.
Okay, he's trying to figure out what his allergies are, or maybe if he has a question. Okay, now let's move on.
All right.
Maybe we'll talk to John a little later on. Let's talk about common allergy triggers. What are the more common allergy triggers here in the country?
Okay.
Tara Capula.
Among children, usually it would start with food, especially milk.
Okay.
Cow milk.
Yeah,
Cow milk.
cow milk, egg, and the shellfish or the seafood. And then later on, you would also develop or be exposed to certain pollens. So pollens are actually common allergens also. And we have the indoor allergens, the house dust mite, the
Okay.
moles, and the cockroach. So those are the common allergens that we have here in the Philippines.
So parang wala kang takas. You're out of the house, you get into the house,
Yeah.
and there are a lot of triggers around you.
Well,
How do
tapos, when it comes to aeroallergens,
Yes.
yung tinatawag.
Aeroallergens.
Aeroallergens, allergens that are in the air, as
Okay.
opposed to food allergens. No?
Okay.
So sometimes when you're wondering, baka why are the aeroallergen sensitivities later? Because it takes a while bago mag-develop. Maybe about 2 to 3 years before you actually develop sensitization to your aeroallergens, which would include pollen, house dust mite. So it doesn't happen instantaneously or early on in childhood. Unlike with food allergies, you can get sensitized early on.
So with food allergies, you've mentioned eggs and
Cow milk.
cow
Don't forget
milk
cow milk.
and shellfish. So when one takes these food items and they don't know they're allergic to it, immediately ba yan? Will it manifest?
Well, usually it may happen immediately, but don't forget that it can still have some late phase of inflammation. So it can go on for hours after the ingestion of your offending food allergen.
Oh, doctors, now we have a caller on the line. Okay. Good evening, Claude.
Hello, hi, good evening.
Hi, good evening. Please go ahead with your question.
You know, I love eating shrimps, and you know, of course, I'm allergic to it, and you know, the allergy manifests itself through rashes. So I wonder, you know, I'm trying to avoid it, but I just find it so delicious. Can it ever go away? Will my body or will my system become immune to it at all in the long run?
Thanks, Claude. Shrimps really are masarap.
So Claude, when did you have your symptoms first?
I think I was in high school when I was 16 years old. That's when I realized I was itching after eating shrimps.
Well, I can understand your problem, Claude, kasi, well, yeah, shrimps are so nice.
Yes,
di
they
ba?
are.
Lalo na the freshest shrimps. Unfortunately, if you're sensitive to shrimp, then you, by all means, you must avoid it because it will be detrimental to you in the long run. No?
It will be.
Yeah, because, you know, most of us actually think that reactions may be just so mild. No? Kasi allergy lang yan, kati-kati, konting kati-kati, you take antihistamine. But sometimes some allergic reactions may be very severe to the point of, you know, having difficulty of breathing because you're having laryngospasm. It's not just about rashes, no? Allergies is more than just rashes. So it may get life-threatening if you intake something that you are sensitive to. Now, some people I know make daya, they take the antihistamine before, or parang some of them would say na, oh, let's just make unti-unti until we get used to it. I'm sorry, but those things shouldn't be done. They're dangerous for your, if you value your life, then it's dangerous really to do that. So Claude, ha?
All right.
Pero magpa-test ka muna. Because sometimes there are some perceived conceptions of allergies. You may think that you're sensitive to it, but actually when you get tested, you're not. And then when we do the food challenge, after that negative testing, you really are not reacting. So sometimes it's a matter of what you ate along with that particular food. So baka yun ang kailangan nating imbestigahan.
Right.
I was hoping it could be mind over matter in the long run.
No.
In certain cases, yes, but not for allergies.
Especially for food allergies, because food allergy actually is the most common cause of anaphylaxis.
Okay.
Meaning what Doctora mentioned earlier, that it will be really difficult for you to breathe because your airways will get swollen. So it's a multi-systemic reaction. It's not just on the skin that it will manifest, but in different parts of the body. That's why I also advise my patients, because we frequently hear that they will take antihistamines first when they really want to eat something like shrimp. But remember that you're just blocking now the histamine that is released during that reaction, but not the other allergic mediators that are going to be released during that reaction.
So forever, Claude cannot eat shrimp.
Sad.
Is that
Have yourself tested first.
All right.
okay?
Thank you, ladies.
Okay.
Doctora. Thank
Thanks.
you, Angel.
Thank you, Claude, for calling. Doctor, you mentioned allergies and rashes. How do we determine which is which? In appearance or in feeling? How do we determine if it's an allergy lang or a rash?
A rash can be an allergic manifestation. Of course, there are other rashes, right? There are rashes when you have fever. There are rashes when you have some other skin problems. But a rash in itself can also be part and parcel of an allergic disease. No? Now, the most common one would be probably the one that we know in Tagalog is tagulabay, the urticarial hives. No? So urticaria, if you hear urticaria, they just mean, you know, those raised elevations, no? Yung rashes na nakaumbok. Okay. So they're reddish borders that have a little raised wheel. Okay, and they're usually itchy, and that's what we call urticaria. Hives is just another term for it, a less scientific term for it.
So the urticaria at which particular area of the body
Any
is
part
most
of the
affected?
body.
Any part.
Yeah, but not all urticaria are due to allergic reactions or due to an allergen. It could be something else, like a systemic disease that caused that urticaria. So not all rashes actually are allergic or due to allergies. So you have to identify now what's the cause of that urticaria.
And which brings us to the risk factors involved in someone who has allergies. You've mentioned early on
Food.
and then the family history.
Family history, yes.
We also have to take that into consideration.
Well, not all people will have family history, but most of them will have a positive family history. So we always ask that when we do our detailed history taking and physical examination, when they come in for consult, we have to ask that, definitely.
And when once you've identified the factors that lead to these allergies of a particular individual, lalo na pag family history, where do you go from there? How do you proceed? And what measures does one have to take in order to alleviate their itch? It's an itch sometimes. It's very itchy and annoying.
You have to find out specifically what your triggers are. Like, hindi naman pwedeng, oh, I'm allergic to food. Anong klaseng food? Diba? You have to be tested. That's when it comes in. How about medications? Of course, also, that can also be a cause of your rashes, or your allergic manifestations. Even sometimes, air allergens around you, even the weather, even stress can worsen symptoms of allergy, but it's not the cause. It can worsen, it can trigger an existing allergic reaction. But it may not just be the cause per se.
You're not allergic to stress. You can't be allergic to stress. It can be a trigger. Can we not be allergic to stress? It's a trigger that will bring about our allergies. Dr. Arcapulang, you
I just want to add that if you have a family history, we really advocate that the mother will breastfeed the child.
Correct.
Because there's really an evidence or a lot of evidences showing that breast milk would actually protect the child up to 4 years old. So for the bronchial asthma, there's an evidence for that. So we really advocate breastfeeding. So primary prevention is really important.
So that builds the antibodies of the baby. Is that correct?
At the same time, you're not exposed now to the common allergens like the cow's milk allergen or allergy.
And
because cow's milk is one of the top rating offending allergens. No? So it follows when you give the mom breastfeeds, so you're not exposing the child to cow's milk. Some moms like to mix their feeding, and then they find out that the baby's having rashes already. Then that can be because of the cow milk and not because of the breast milk. Remember, cow's milk is for cows and breast milk is for human babies. So.
You've mentioned earlier that there's a test that has to be given. We talked about that briefly. For children, since we're on the topic of children, is it the same test that the children get when they know they have a family history? Is it the same test that the adults get?
For the allergy? Yes, but to a lesser degree. I personally put lesser allergens because they won't be able to stand perhaps the pain of having so many
little
scratches. Yeah.
Scratches. Okay.
It's just a little scratch, but of course for babies, the sense of excitement, maybe and pain is different from what adults can tolerate.
So is this the only diagnosis that can be done for adults and for
the only
babies?
testing, you mean?
The testing, yes.
Testing aside from the skin test.
Yes.
We also get the blood test. We have the serum, IgE levels for blood to identify these allergens aside from the skin prick test that we do. But just to add, regarding that one for the children, we just select it because if you're not yet exposed to something, you don't develop now desensitization also. So we just select the allergens that we're going to test also for children.
Okay, so for both the adults and the children.
It's a very simple test actually.
Is it a painful test?
No.
Well, you will feel it, okay?
Is it like an ant bite?
Not even.
Okay.
It's like you got scratched with a sharp pencil.
Okay.
But several times.
All right.
Okay? So if your test panel is about 20, then you have to do that 20 times. But it's just a simple putting a drop and then scratching it and then waiting for it to get red. That's all.
And your allergologist will perform that
Yes,
test?
only the allergologist, or to be easier, allergist.
The allergist, okay.
That's an
It's
easier
a tongue
term.
twister kasi the allergologist.
Allergologist is a tongue twister. Speaking of allergies, there are certain myths that go into the understanding and knowing more about allergies. We will talk about the common myths about allergies when MedTalk returns. We're back here on MedTalk, still talking about allergies. You may join our discussion by calling our hotline at 548-4678. Before we talk about the myths, doctors, let's talk about the most common allergic diseases. Let's start with hives. What exactly are hives and how does one get them?
Well, yun yung tinatawag nating urticaria.
Okay.
And that's the one that we raised yung wheels. Yan. And like as discussed earlier, it can be caused by a lot of things, food, medications, air allergens, exposure to all sorts of things. Even sometimes weather can trigger, stress can trigger. Those are not exactly causes, but trigger factors.
Okay, both in children and adults.
Both.
Yeah.
Okay, and
Even pollution can even
it's a
aggravate
trigger.
it. Yeah.
And the best remedy for someone suffering from hives is to go to the doctor right away, or is there any medication that one can take?
Well, it's safe enough for them if they've been having these hives paulit-ulit. No? More or less, they would know that they take an antihistamine, which would lessen the reactions, but they should have a consult with their doctor about it.
Eczema, Dr. Capulong. What exactly is eczema?
It's actually atopic dermatitis. It will manifest initially when you're younger, but especially if you follow now the atopic march or the allergic march that we call it, it's more common among children, but it could still appear when you're older. So you would have now itchiness when your skin will get itchy and you scratch it, then the rash will appear. It's usually an itch that rashes, parang baliktad siya.
Rather than a rash
that
that
itches.
itches.
Okay. And it's a chronic disease actually. It will keep on coming back. So you really have to identify the cause, and then skincare is also important.
That will never go away.
It will never go. And if the cause is actually food, then it may at least be controlled, but not really go away.
Okay. How about asthma? Asthma brought about by a certain allergy. What can trigger an asthma attack?
Okay, asthma in the first place is not all due to allergies. There may be adult onset asthma that may not be due to allergies, but chances are, if you had your asthma early on, like say childhood, chances are most of that is because of an allergy. You have an allergic reaction, you react to it, and then your reaction, your body reacts in a sense that you cannot breathe, you're having difficulty breathing, you're having coughing spells, you wake up at night having coughing spells. So those are part and parcel of what's happening with you when you have allergy. Because you have actually a narrowing of your airway passages, and at the same time inflammation around these airway passages. So you really need medication that will help open up your passages and at the same time take off the inflammation around your passages.
Dr. Capulong, let's go to allergic rhinitis or hay fever.
Okay. Patients with allergic rhinitis would usually have colds that won't go away. Usually they would occur in the morning, then after they take the shower, it would now subside or disappear. But the next day, it will keep on coming back. Okay, so aside from the colds or the runny nose that they have, they may also have sneezing, stuffy nose also. Sometimes they will get itchy eyes or nose and throat. So most of the patients will tell us actually that, Doktora, normal lang yan sa akin. When I wake up, I sneeze, I have colds. So they think it's normal, but if it keeps on coming back, especially morning or evening time, then probably you have allergic rhinitis.
What is it about morning and evening time that triggers allergic rhinitis?
There's a lot probably of your exposures to your allergens, and of course positioning also during the night, and then you end up having more secretions, and you end up having more of these symptoms. No? Ito yung mga batang uhugin, diba?
Okay.
Sipunin,
So
lagi parang hindi nawawala ng sipon,
Okay.
hatching ng hatching.
Right.
But people think na parang very minimal lang yung symptoms, no? Parang kasing sipon lang yan. So,
Yes.
they hardly come in for a consult until it's very bad already. Bear in mind that most people with allergic rhinitis will also have asthma. And at the same token, most people with asthma will also have allergic rhinitis.
Okay.
It's what we call a united airway disease. You have to treat both so that you will have control for both symptoms. Because if you just decide to just treat kunyari the asthma and not make pansin the allergic rhinitis, then baka hindi mo makontrol ng todo-todo yung asthma mo.
Okay, but an individual can have allergic rhinitis without asthma and vice
Yes,
versa.
yes.
And if not treated, for example, you just dismiss your allergic rhinitis because it's just a cold. You can just blow your nose and then, during the day it's going to go away and then it'll come back at night. Is there any repercussion to not addressing,
Because
just leaving it, letting it be?
Yeah, there are complications actually if you don't control now your allergic rhinitis or you don't at least take the proper medications. If we could mention some of the complications, sinusitis, you may also have recurrent tonsillitis, ear infection, and also what we don't want really is it will progress now to asthma.
Okay.
So you don't just take it lightly.
Correct.
So it has to be controlled.
Yeah.
How about the worst case scenario of an allergic reaction, anaphylaxis? What exactly is this and how does it get to that point?
Well, anaphylaxis is the most severe type of allergic reaction that you can ever have, no? And people just think na, allergic reaction very, very mild, no? But contrary to that, no, anaphylaxis being the most severe nga, can also be life-threatening. So, and this thing just happens in minutes. This is kasi a multi-system problem. No? All the systems are now working against it. No? We're not talking just about having rashes, but rather having some difficulty breathing. And worse, when you have already laryngospasm, when you're able to breathe, supposedly you have a mechanism to breathe, and yet air is not coming in because it's so tight and that you can't breathe. So if you don't get the necessary medication during that time, which is epinephrine, no, you actually end up as a fatality. And we don't want that to happen, which is why we're trying to make people more aware na you have to treat your allergies. You have to find out what your allergies are and then do something about it before something happens to you.
And in understanding, treating, and knowing your allergies, we also have to know the myths that surround these allergies. So myth number one,
Madami
doctors.
yan,
Oo,
Angel.
nako, let's start with number one.
Okay.
Symptoms of an allergic reaction will always appear immediately after eating the food that caused it.
Okay, I think we discussed that also
Yes,
earlier,
we
but
did.
it's good to actually repeat, no?
Yes, please.
It can happen immediately, but there are instances wherein it can extend to hours after eating the food, no? So sometimes hindi ma-identify nila because tagal-tagal na lang bago nila kinain yun. Maybe nung gabi, tapos tanghali pa nila kinain. But it has to be identified. It has to be checked out kung ano yung mga trigger factors ng yun.
And you have to backtrack, no? If you've eaten a lot, so parang you have to single out
Yeah.
each and every food item that you've taken in.
Which is why in our evaluation of these food allergies and this urticaria, we actually encourage people to have a food diary.
There you go.
Just to put down what you've eaten for that moment, for that particular day, and even the small things that you eat. No? Because that will help your doctor try to investigate what you're sensitive to. Para kaming detective. Diba? But you must give us clues. Hindi naman pwedeng clueless.
Parang
Tapos magic
mahuhula
yan.
na lang.
Sa inyo na lang lahat, please help me na lang. Because some patients, syempre, they're very worried already and they can't remember anymore and they leave the clues to you.
Ang hirap no, ano yun, psychic. Diba?
You have to guess. It's like a guessing game.
They have to recall. They have to recall what
Guessing
they
game.
ate.
That's a good idea. No? If you know you have food allergies, write them down
Right.
so you can eliminate
At saka,
the
in
food
writing
items na
it
hindi ka
down,
allergic to. Oo.
in writing it down, you can actually notice which one that you're eating often that you get a reaction from it.
Okay.
Sometimes when you're eating it, hindi mo mahalata kasi matagal-tagal na. But when you actually write it down and then makikita mo doon sa kalendaryo mo na,
Yes.
oh, each time pala I eat
Okay,
this, so I'm
get
getting
a
some problem, then you can at least more or less get an educated guess.
Okay. Myth number 2. food intolerance is just a less severe type of allergy.
Intolerance is different from allergy because when it's intolerance, it's usually in the enzyme. There's a problem with the enzyme, like milk intolerance. It's different from milk allergy. So if you ingest now anything, any dairy products, if you have milk intolerance, you may also manifest with abdominal pain or diarrhea. So they're two different things.
Okay.
Sometimes you can also have some food intolerance because of the particular food itself. It kunyari with cheese. You're not naman actually allergic to cheese, but cheese has a lot of substances that make you, make you feel bad. And this is na pagkakamalang allergy when actually hindi naman.
Okay, so it's an intolerance to that particular type of food. Thank you, Doctor. Myth number 3. Allergies can be cured. I hope they can.
They can just be controlled.
Okay, controlled, not cured.
That's one thing we actually always reiterate. Allergies cannot be cured, but however, they can definitely be controlled.
Okay, just don't go near or expose yourself to the triggers because they're going to
Avoid
flare
the
up.
triggers.
You have to
Avoid,
avoid all
yes.
triggers. Okay, myth number 4. You cannot develop an animal allergy if you do not have pets.
Well, if you have to be exposed, and alam mo naman sa Pilipinas, lagi ka namang
Si
merong
Bantay at
stray cat at stray pet, stray dog, di ba?
Yes.
Si
Si
Bantay
Bantay
at
at
si...
Muning ba?
Muning?
Muning.
Kuting?
Muning,
Whatever.
yes.
Si Muning. So, there will always be animals surrounding you. And sometimes, even if they're not at your own home, well, you have visitors. So and they have their pets. So, they come in and they bring it in their clothing, nakadikit yun. Especially cat allergen, cat dander allergen. Very sticky. So, you can just have a visitor who has a cat and bring it into your household, even if you don't have a cat at your own home.
Okay, so that's a trigger. Again, it's a trigger. Okay. Myth number 5. Most people will grow out of allergies to peanuts. You outgrow your allergies to peanuts, seafood, fish, and tree nuts. We were talking to Claude earlier.
Yeah.
Unfortunately, no.
Yes.
Unfortunately not.
Shrimp allergies.
There are some who somehow as they get older nawawala na, but you cannot really predict which
If you're the
person will
fortunate
actually
one,
Okay,
diba?
so as you get older,
Spinawin lang yan.
as you get older ba, so kunyari, you're allergic to shellfish or like an apple maybe. As you get older, nawawala yun, it's replaced by something else, but you still have the
can be.
allergy.
Yeah. As you get older, pwedeng mawala yun.
Yes.
But yes, you can develop new allergies even if you're old.
Okay. Myth number 6. If you are allergic to egg whites, you can still eat egg yolks.
So hard to separate egg white from the egg
Totally,
yolk.
Ganun ka ba
Dapat
kagaling?
expert ka talaga.
But maybe if you hard-boiled.
Oh, yeah, that's easier.
If you hard-boil, at least you can separate talaga the white from the yolk. Okay, but not if you're asking me if I separate it in the egg separator. People who bake actually know that sometimes there will still be traces of egg whites that go with the egg yolk. So, baka doon ka madali.
So is it
sa trace na yun.
safer not to eat it na lang?
Not to eat it at all.
Not to eat the whole egg.
Not to eat it at all. Sometimes, it was mentioned tree nuts or peanuts. Sometimes others just sniff
Yes.
the peanuts,
It's possible.
and then you get allergic to it. I understand in the United States, certain schools have tables which are peanut-free. So if you have like peanut butter in your baon, you have to sit in a different table, and that's how they designate the children because of these allergies.
So even if you don't ingest it, you sniff it or
Yes.
just hold it. Because
Yes.
I have patients, if they peel the shrimp when they eat, that's the time that they get rashes.
Well, as for peanut allergy is not too common here in the Philippines. Not as common as it is in the United States. No? So that's why our Western literature would always mention peanuts.
Yes.
But here in the Philippines, our experience is not too much on peanut allergy.
So what is
We're
the
more
most
on
common?
seafoods.
Seafood.
Bagoong. Diba?
The good
Bagoong, shrimp, yan.
Shellfish, no?
The ones who tested, in my practice, the ones who actually tested positive for peanut usually have Caucasian blood or European blood.
Okay. So doctors will talk more about allergies, and I understand National Allergy Day is coming up. We'll talk more about that when MedTalk returns.
All right.
Did you know that while allergies can affect anyone regardless of age, it can fade away in your mid-50s as the immune system becomes less vigilant?
We're back here on MedTalk, still talking about allergies. So this time, doctors, let's talk about National Allergy Day, which is coming up. Please tell us about that, Dr. Capulong.
July 8 is actually the National Allergy Day. There's already presidential decree, promulgation that July 8 is a National Allergy Day. But for this year, we're going to celebrate it on July 11. It's going to be held in SM Mega Mall Activity Area, 5 to 7 p.m. But there will be booth exhibits that will be open starting at 10 a.m. and they will close they'll close until 10, or will close at 10. So we would like to invite actually those watching here to attend that lay forum, the National Allergy Day Forum on July 11, 5 to 7 p.m. at SM Mega Mall Activity Area.
It's actually a learning camp, a lay forum for set up by the Philippine Society of Allergy, Asthma and Immunology.
Okay.
So it ought to be good.
So there will be lectures. And some activities also will have games. So it will be a form of learning through games also, aside from the usual lectures that we have.
Oh, para fun naman,
I was going to say, sana meron test doon, test that allergies, catch
Walang
test.
exam.
No, no consultation, no testing.
But prior to the National Allergy Day activity, we're going to conduct free clinics for the month of July every Friday and Sundays in selected department stores, actually in certain areas. But that's for July, the whole month of July, Friday and Sunday. They're going to be
actually all hospitals nationwide are celebrating this National Allergy Day. In fact, in my home hospital, the Medical City, we have a week-long celebration of. We make it a National Allergy Week, you know, because we intend to increase awareness of these allergic diseases. So in all hospitals, iba-ibang activities ang mapaano, but all aimed generally to increase awareness of these allergic diseases.
So in the aim to increase awareness, does that mean that we're not as informed, or we're not as educated, or we're not as interested to find out more about our allergies and how to cure them?
Kulang pa rin siguro because we're still getting a lot of consults na parang first time nga daw nila nakarinig na may allergologist, sabi nila. And they always ask us, how do you say it? Parang hirap. Sabi ko, okay, the easiest way, just say allergist.
Okay.
Okay, we shorten it now, just say allergist. But not many people are aware, surprisingly, no? Hindi pa aware. So we really have to keep on pushing that allergic diseases is just not, skin deep. It's more than that. And it can even be life-threatening. So it really is best to have yourself tested. Claude, I'm talking to you.
And to all the other viewers out there who might have allergies, who dismiss it. Because it doesn't really bother them. Kasi sometimes if it doesn't bother you, you will not take pains to address it.
Iintay mo pa bang that it bothers you? Kasi baka mamaya, during the time that it bothers you, it's really, really bad already. You're already on anaphylaxis.
Which we don't want
to happen. We don't want that to happen.
But what we want to happen is to cure and to address it right away.
Control, not cure.
Control, okay. I always hope there's a cure, but to control it.
Wala kahit kami gusto namin i-cure hindi talaga. So we're here to help them out, help them identify their allergies, their allergens, and help them find a way, make a treatment plan for them, what to do if should something happen. So they must be also aware before they get to the doctor.
Is the lifestyle change part of the treatment plan that you give to your patients?
Definitely, definitely. Because, if you're sensitive to certain animal dander or dust mite, there are certain measures that you can do to avoid or even minimize your exposure to these allergens.
Like, for example, food. What can one do? What kind of lifestyle change can one adapt?
Wala, just avoid.
Unfortunately, just have
to
avoid
lang
it.
yan.
And for the environment, avoid. What if you can't avoid?
That's
It's
where the
difficult.
immunotherapy comes in, actually. We could
Yeah.
offer that one. We offer immunotherapy, or it's indicated for patients with allergic disease, especially if they're not being controlled with the medications that they are taking. If they really can't avoid, especially the pollens and the aeroallergens in general. So immunotherapy could be done for these patients, and only the allergists could administer the immunotherapy to the patients.
What exactly is immunotherapy?
These are
What
allergy
happens?
shots. Okay, first you get tested, right?
Okay.
So the allergist would find out what you're sensitive to and would make a treatment plan for you. For those with allergic rhinitis and bronchial asthma, immunotherapy is definitely warranted because there are studies that back up the efficacy of these immunotherapy for such diseases. Not so much for urticaria and atopic dermatitis, no, but mostly for asthma and allergic rhinitis. So for those who have been, who have been seeing their doctors for so long and are on medications and yet they still have some problems, they may have some allergy problems, so they have to be tested and then they could be candidates for immunotherapy. They're actually just small injections, subcutaneous. Very, very small needles.
Okay.
Takot ka naman sa injection agad.
Because sometimes, others, when you say a needle or an injection, it brings about fear.
They're very small, and we
very
usually
small.
put them in the subcutaneous fat tissues. So it's hardly felt because we really use just gauge 27 needles, and those are very fine needles. No?
Is that administered often? How often should one
Like
get that?
weekly. First we set nga which ones that you're sensitive to. Then we usually advise you to go on weekly shots on very dilute strengths, gradually increasing every week in volume and in strength until we reach the endpoint maintenance phase. Once we're in the maintenance, then we can go on to, like, say, every 2 weeks and then move on to every month. But immunotherapy per se really is good for 3 to 5 years.
Oh, okay.
But it's very effective. And those who have actually undergone immunotherapy swear by it, which is probably why they continue it. Because why would they continue something that you perceive as painful? Kasi injection, no? And you're going every week or every
Yes.
month, no? Parang maabala. And yet, there are many people who undergo immunotherapy because they believe in it and because they've actually been helped with immunotherapy.
They have got, their allergies have been
Improved.
improved,
Yes,
under control.
Improved and controlled, right. And, my favorite patient who had immunotherapy was this, he was a 10-year-old boy who had allergic rhinitis. He was first seen by another allergologist who unfortunately had to migrate to the United States. So, napasa sa akin. And I went on to continue his immunotherapy. Sa kakapunta niya sa ospital, medyo naengganyo yata maging doktor.
Oh, so
and
nice.
now he's a doctor
Wow,
na.
how
Graduate na,
nice.
yes.
And his allergic rhinitis is still there.
It's controlled.
It's controlled.
And what he said nga, because he was so annoyed with all these symptoms, that's why he, as a 10-year-old boy, he actually asked his parents, can't we do anything? Can't we go to someone who can help me? Siya mismo. And that's when the immunotherapy came in after he was tested. And because he didn't already experience these symptoms of clogged nose, almost half a day daw dati, no? Clogged nose, sneezing, he was able to focus more on his studies.
Oh, that's nice.
No? And then he went on to Philippine Science High School, then he went on to UPPGH for an intermed program. So now he's a graduate already.
So the
I'm proud of him.
allergist, that's a very encouraging and
became an allergist.
So
he's
I'm
now an
hoping-
allergist.
Not yet.
Not yet, okay.
He's still studying for his boards, but I hope that he will maybe go to immunology, an allergy for his specialty.
But it can be cumbersome, no? To suffer from all these allergies.
Yes.
Like other preventive treatments, I know of people who use a spray for their
Yes.
nose when they have allergies. Is there any other treatment that is available in the market or here in the country that can control that?
For nasal allergic rhinitis, no? You mentioned the nasal spray,
Yes.
no? I usually go for saline wash first and then a corticosteroid nasal spray. These are indicated for allergic rhinitis. These are the medications, not only antihistamines. No? For asthma, there are also inhaled corticosteroids, which again also help. Now, why all these corticosteroids are inhaled? Well, corticosteroids are actually very good anti-inflammatories, but they just get bad publicity because of all the side effects of oral corticosteroids or systemic corticosteroids. But what we're talking about is inhaled corticosteroids for asthma and nasal corticosteroids for allergic rhinitis, which just act locally on the nose or the lungs, and which is where the inflammation is happening, and which is where it's going to be most helpful. So that's why these things don't get much absorbed, naman. They get to be helpful without the bad side effects of corticosteroids.
You mentioned absorption. How about the tablets that one takes when we have allergies and the body absorbs that? Is there any other alternative to taking those little tablets when one has a medication or when one
oral
has an allergy?
antihistamines,
Yes.
you mean? Well, the oral antihistamines, they're a whole class, but there are different brands. No? It depends on siguro if you want a sedating one or a non-sedating one.
That's a severe case already. It's
Some
sedating.
people can't sleep because of the itch. So sometimes it's helpful also to give a sedating antihistamine. But for those who want to be functional in society,
Yes.
of course, they are always requesting for a non-sedating antihistamine. And the newer ones are non-sedating and are very convenient to use, just once a day. Very effective.
Aside from
Dr.
the antihistamines, we also have oral medications like the anti-leukotrienes that we have, and it's very easy to administer to children because it's chewable and tastes good. Aside from these tablets, we also have the topical steroids for the skin. So if you have atopic dermatitis and you have the rashes, it's very important that you apply these topical steroids, the creams and the ointments. And of course, important would also be skin care.
So skincare, once
When you have atopic dermatitis or
Dermatitis.
eczema, yes, very important part.
when you have allergies, you must go to your allergist,
Allergist.
and you must keep them under control. You know, it's difficult kasi to address these allergies on your own. Sometimes you want to self-medicate because you don't want to get in touch with your doctor or you don't want to see your doctor. But again, you can't stress the importance of seeing the allergologist
Yes,
and
for one
making
thing-
sure that your medications are correct.
Yeah. And for one thing, no, for another thing, some allergies, you know, some people with allergies, they go to individual doctors, individual specialty doctors. But when you see an allergist, you actually see, your doctor will actually see you in totality, whether it's the nose or the lungs or the skin. So that's covered, at least for allergies.
Okay, so thank you very much, Dr. Casala. We don't have enough time anymore, but it's a very interesting topic. Maybe we can have you again at a future
For sure.
episode.
Thank you so much, Angel.
Thank
we
you very
enjoyed it so much.
much,
Can,
Dr.
can we
And
just
Dr.
invite
Capullo.
our other doctors?
Okay, briefly,
Yes.
Doctor.
Yes, we have a biennial convention in September 8 to 9 at the Sofitel Philippine Plaza. We're inviting our fellow doctors, whether they're GPs or pediatricians, so that you can actually learn more about allergic diseases. It's leaping into the new AGE, that's allergy, genetics, and environment.
Okay, thank you very much, Dr. Casala and
Okay.
Dr. Pulong. See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. I'm Angel Jacob. Good night.
But other manifestations would be runny nose, sneezing, cough, congested nose in the morning. These would be symptoms of an allergic rhinitis, wherein the swelling is actually inside the nose.
Allergy should be dealt with seriously, as one reaction can lead to something severe.
An allergic reaction can be life-threatening. It's called anaphylaxis. This is when there is a trigger that causes a very severe allergic reaction. The throat closes, you have difficulty breathing, your blood pressure suddenly drops down, you may lose consciousness, and you get swelling in the mouth, in the tongue, which makes it difficult for you to talk or even to breathe. And yes, it can lead to death.
Allergies can be developed at any age and can obviously be annoying, but it does not have to be disabling if treated and managed properly. What are some of the risk factors for allergies? What allergy medications can you possibly take? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Maria Carmela Casala, a fellow of the Philippine Pediatric Society and a public relations officer and fellow of the Philippine Society of Allergy, Asthma, and Immunology. She's also the head of the allergy section in the Department of Pediatrics of the Medical City. Also joining us tonight is Dr. Regina Capulong, a diplomate of the Philippine Society of Allergy, Asthma, and Immunology, and a consultant of the Medical Center Manila and Manila Doctors Hospital. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Our immune system is designed to combat and protect us from destructive viruses and bacteria. But sometimes, it can wage war on some foreign substances that can be pretty harmless for most people. The main culprits are usually allergy-producing substances called allergens, which are often erroneously identified as dangerous and unfamiliar invaders by your immune system. The most common allergens include certain food items such as peanuts, milk and eggs, pollen, dust mites, insect stings, some medicines and clothing, plus many others.
Well, here in the Philippines, the most common manifestation of our term allergies would be a skin rash that is longer than the usual amount of time that these things last. Most patients beyond 6 weeks would usually come in for testing.
I mean, which causes all these symptoms that you have?
Dr. Capulong, how common are allergies?
Actually, it's very common. Around 1/3 of the whole population, meaning worldwide, actually have allergic diseases. In the Philippines, it would range to about 20 to 30% for the respiratory allergies. So, and that prevalence is actually increasing because of the increased awareness that allergic diseases do exist. So the prevalence, we'll expect it to get higher.
Prevalence meaning, you know, the number of people who have it and who are actually suffering from that disease.
But that's a big number around the world, 1/3
1/3.
of those who have allergies.
In fact, if you make a, you know, kunyari may survey ka,
siguro kunyari 10 people, kunyari here in
here lang in the studio, you ask around, you probably would get roughly 1/4 to 1/3 of the population.
Are you part of that population, doctor? Do you have allergies?
Me personally, I don't have. But I'm more of the rarity when it comes to the allergies, not having any allergy complaints. Usually meron, but I'm one of the few who don't have.
So that means your immune system is good? Does that hold true?
No, it just means maybe that there's not much family history for allergies. We have to discuss that family history.
Family history.
Ask Reggie. She's
Dr.
the allergic
Capulong,
one.
do you have allergies?
Yeah, I have atopic dermatitis. It started when I was younger, and then later on I developed allergic rhinitis. But what Dr. Casala mentioned earlier, there really exists a family history because my mom also has atopic dermatitis. I have a sibling who has allergic rhinitis and bronchial asthma. And my children also have these allergies.
Mana pala.
What about you, Angel?
Yes,
you
I
have
do.
also?
I do have allergies, which brings us to the categories of allergies because I do have food allergies, a little bit of atopic dermatitis, and
Good evening, Angel. It's good to be here.
allergies. What exactly is an allergy?
Allergy is actually an overreaction or hypersensitivity reaction to substances that are usually not harmful to other people, But for somebody with allergies, once you encounter now these allergens, what the body does is that it produces now what we call antibodies that recognizes intruders in the body. So thus antibodies will now travel to the mast cells that are found on the skin and the respiratory tract. And once you encounter again these allergens, then you may have the allergic reaction.
Dr. Casala,
Yes.
allergens. Dr. Capulong mentioned allergens. What exactly are allergens?
They're the substances that you get to be sensitive to. No? They're usually protein substances, and that anything possibly in the world can actually be an allergen. No? So whatever you're sensitive to, those are the allergens affecting your life. Okay. Now, like Dr. Capulong mentioned, no, these allergens, if you're exposed to them, that's when you get a reaction, an inflammatory reaction happens during that time. And that's when you actually get all this itchiness, this teary-eyed or itchiness of the eye, sometimes even asthma attacks. No? So the hives also come out.
And these are the reactions that your body has to a certain substance. It could be anything.
Yeah,
From
and
food
even
to
the
the environment.
even the reactions are different and varied amongst people.
And the reactions are different and they're varied amongst people. This reaction of our body, is it called an attack, an allergy attack, just like an asthma attack? Would you say that it's the same, Dr.
It would be
Capulong?
probably better to call it an allergic reaction than an attack. But some people call it an attack because usually what they would notice would be the acute reactions after being exposed to an allergen. So it would be better that we call it an allergic reaction.
Okay, so now it's an allergic reaction. I wrote it. Allergy attack. So that's not the nature of what happens
Kasi
to your
parang
body.
very negative naman. No?
Yes,
Because
yes.
in actuality, no, an allergic reaction is actually the body's way of defending oneself. Because the body thinks that this is something that shouldn't be with you, so it tries to eject it. And in so doing, you get some inflammatory reaction, and that's when the whole thing blows over. No?
An attack is parang more severe, no? It's more of a medical emergency.
But
when
we
say
do
it's an
use
attack.
it for, like, say, asthmatic
Asthma.
attack,
Which is also a
which
form
is
of
also
allergy.
a form of
Yes.
allergy, right?
Okay. So what is the nature of an allergic reaction? What happens to our body when we are, let's say, allergic to a certain type of substance? Dr. Casala.
Well, when your body, okay, when the defense mechanisms in your body meet your nemesis,
Okay.
your allergen, then a certain reaction happens, and they actually cross-link, and then this causes the mast cells to release preformed chemical mediators. No, mast cells are actually specialized cells in the body that are responsible for this, all these allergies. Now, so when the preformed chemical mediators are released into the system, including histamine, now that's when you get all the redness, the erythema, the itchiness that you have, the difficulty of breathing perhaps, and all the hives. No? And that's why most medications that people know to use for allergic reactions are called antihistamines, because they fight off the effect of your histamine.